Good morning and thank you for watching Sunrise at Sea. You're just in time for Wellness this morning with me, Sandra Kopp, and I am back to talking to Dr. Moses Mulioa of St. Ruth's Medical Center. Good morning, doctor. How are you?
Morning, Sandra.
It's good to have you yet again back on our show.
My pleasure.
Well, today we are talking about ulcers. And first, I'd like to know how does someone know that they have ulcers? Because you have some people saying, oh, I have ulcers, but they actually don't know. They just assume that they have ulcers. So how does someone know? What is ulcers and how does someone know that they have them?
Okay, stomach ulcer, commonly known as peptic ulcer,
yes,
is a sore that develops on the lining of the esophagus, stomach, and that's all the small intestines. So ulcers occur when stomach acid damages that lining of the digestive tract.
Okay.
So in most cases, people present with pain, mostly in the upper abdomen, and around, we call it the epigastric region. So that is how in most cases someone can know, possibly, I have ulcers.
So you said also on the tract or in the throat as well.
Yeah.
They can
also present there
in the throat and then all the way through the intestinal lining.
Yeah.
So what are some of the symptoms apart from pain in the upper area?
It usually presents with that epigastric pain. We have nausea, which can also be affiliated with vomiting. So then also diarrhea. Yeah.
Oh, to an extreme also, someone can have diarrhea with ulcers.
Yes.
So how does someone know that they have ulcers? Because if you have sores inside here, don't you have to get them checked to find out if you actually have these sores?
Our advice is always to seek a health profession who will be able to examine and know that we are dealing with what? With ulcers. So in most cases, there are a series of tests which are carried out, and these tests will help us to identify the causative organ, the H. pylori. It's a bacteria. So in most cases, once we detect it, we now know we are dealing with ulcers.
Oh, so what do you check? Do you check the blood for this, or you check the saliva for this?
We commonly use blood, but also we can check through the saliva and also the stool.
The stool.
Yeah.
Oh, because one of the symptoms is diarrhea as well. So what are the remedies that someone can use to counter this if they get an ulcer attack? And before they get this ulcer attack, like if you have ulcers, I have ulcers. Yes. So usually I avoid certain kinds of foods like that have citric acid, like pineapples.
Yes.
When I eat pineapples, I can get an ulcer attack if I have not eaten. That's why my friends keep on telling me that I eat like a baby. I eat little, but in quantities, but spread out, because I don't want to be in a certain kind of situation where I'm hungry for too long. Then even if I eat, it's not going to solve the problem. I already feel sick.
Actually, one way of advising our viewers out there with these symptoms is always to eat in time.
Exactly.
Have their meals in time. If you know you're having a long journey, at least pack yourself a yogurt.
Yes.
You can pack at least a cup of, maybe we usually have bottles, you can even carry milk.
Yes.
So
a smoothie,
there is
sandwich.
even a smoothie can actually do better because it can keep you going.
And bananas always work for me.
Yeah, but in most cases, some people may actually, some bananas may even trigger that.
Trigger ulcers.
Yes, so we actually, if you take it like on an empty stomach, you may find it may trigger a bit, but it's also good as an accompaniment.
Yes.
Yeah, to the non-acidic foods.
So eating on time. If you have ulcers, you have to eat on time. Those are one of my tricks.
Yes.
I always have to take my meals on time.
But the best, in most cases, when we to go about, after of course diagonizing,
Yes.
In most cases, we've done the test. Some we even go extra, depending on the severity. We do endoscopy to really look at the extent of the ulcers.
Oh.
So, yeah. So in this, we are able to now know exactly what we are going to manage. But commonly in our treatment protocols, we usually use medications that will help us to decrease the stomach acid production.
Like Relsa?
Yeah.
Or magnesium, something with magnesium.
We are using magnesium, trisilicate. So these help us to decrease on the acid production. But in most cases, we use a series of medication like what we call protein pump inhibitors. We have now the omeprazole, the esomeprazole. There are so many which are now on market. Antibiotics. Then we have antidiarrhea sometimes, because when someone presents with like diarrhea, then also antacids, which actually will help us control the acid levels. Yeah. And
what about taking milk? Many people say, oh, if you're feeling that way, go and take milk. Does milk help really?
To a certain extent, milk helps, but it has helped many. But I would advise if someone can use yogurt, plain yogurt, non-flavored.
Yes.
It actually does a very great job compared to the milk, the plain milk. Yeah.
Are ulcers, are they curable, or if you have them for life?
No, they are curable. They are curable. In most cases, to me, I always take ulcers as a behavior kind of, because you find like someone takes over 12 hours without a meal. What do you expect?
And they drink coffee. Coffee accelerates on an empty stomach.
And you'll find them either they are good at enjoying sodas, coffee. Now, you can imagine you are taking that, which has an acid extract, and what do you expect? Increase, a spike in the what?
Yes.
In the acid levels. So in most cases, it's behavior. So if you know that I'm getting this way, I need to ensure that I have my meals in time, to ensure that, you know, you will try to control. Actually, you put the acid produced by your stomach to use by giving it food.
Yes.
So at least it will lessen the effect of the acid destroying your lining.
Thank you, doctor. Thank you for that information on ulcers. At least now I know better how to. And people out there, the viewers, know better. Remember, once you know that you have ulcers, and to know that you have ulcers, you actually have to go for that test to check. They do a blood test, and you check if you actually have this bacteria, you say,
yes,
in your blood, so that they can rule out. Yeah. Yes, so they can rule out if you have ulcers. And once you have ulcers, just know that you have to change your behavioral pattern, because it's a lifestyle change. You have to change that. It's all about self-care, people, especially now as we have learned from this pandemic how to better take care of ourselves. So please take care of yourselves, and remember to eat on time, to hydrate, and to avoid those fizzy drinks and other foods that have the extra acid in them. Well, thank you so much, Dr. Moses Muliowa.
My pleasure.
Yes, and he is from Ruth Medical Center, St. Ruth's Medical Center. Well, that was all we had for you on Wellness this morning with me, Sandra Cole, but do not go anywhere, because we'll see you in a bit. Don't blink.